if we believe the best dentistry is the least dentistry, and the least dentistry being dentistry earlier on in the life cycle of damage, then we owe it to our patients to analyze any information that we can get in the diagnostic appointment to say, how can we help you? How can we help you be healthy? How can we help you be healthy earlier?
Welcome to Masters and Mentors, the podcast where we talk with leaders shaping the future of dentistry. Today, we're exploring the innovations transferring diagnostics, workflows, and patient experience, and how Heartland dental supported doctors stay ahead of that curve. I'm Dr. Bill Bloink, and I'm joined today with Dr. Tim Quirt, Heartland Dental Director of Clinical Operations, and Dr. Seth Gibree, Senior Director of Clinical Advocacy. Welcome, guys.
Thanks. Yeah, this is great.
Really happy to have you, especially on the inaugural
Leaders of dentistry, right? So that's a little bit of a loose term. Just want to make sure that we're
Disclaimer, yes.
a little disclaimer here this
Well,
morning.
really happy to have you guys this morning. Let's just dive right into it, shall we? You know, Dr. Quirt, you're so involved. Both of you are so involved in the technology that we're adopting here at Heartland. Can you share with everyone where you see dentistry headed with AI, and what has excited you the most in the last 5 years about technology?
So that's a very loaded question, isn't it, Seth? So first off, Seth and I have known each other for what, 20 years?
More.
Right, those lines. So and we've been kind of chasing all different type of industry trends, let's say. And the biggest one I think in the last 8 years, because it's been about 8 years now, was on AI. And still is. I think we were in AI before people thought it was cool. And boy, I gotta tell you, there is so much going on right now, just in that realm of things that, and I don't want to like over exaggerate this, but I think it is the greatest change to dentistry that we've ever seen. And as we know, because Dr. Berkman will say the same thing, high speed handpieces, digital X-rays, PVS, all these different advancements over the years. This is the literal largest one.
Holy moly.
Yeah.
That's great. So finish this sentence for me. The next big leap, Seth, in dentistry will come from.
I think, like Tim said, it's the AI realm. Now, if you think about AI, it's software, and we've had software for years. It's just the ability of the software to do different things has just exponentially grown. And I think within AI, where the next big leap is related to the medical dental integration. So before, we are at the forefront of that because patients come to see us on a regular basis. A lot of times they don't see their physician on a regular basis. So they're seeing them when they have an emergency or they just feel bad. And so they're not getting a comprehensive exam. With them seeing us on a regular cadence, it opens the door for us to be really intervention specialists, so to speak, from a medical side. So I think we'll see a lot of things where in the dentistry realm, we will catch things like diabetes earlier. We'll catch heart disease earlier. We'll catch stroke, Alzheimer's, all those signs and symptoms through salivary testing, other diagnostic tests that are being developed that before you couldn't manage the data and the science behind that. And nowadays with AI and the things that it's doing, you can actually bring that information together to help people be healthier earlier and live longer.
Let me ask a question though, because I think we would all admit we're all dentists. There's a huge disconnect between the mouth is connected to the body. Am I right on that?
I think it is. It's
Yeah, and that is the part there's still something there. I don't know how many more studies we need to show that periodontal disease, for example, is causes all these other issues in the body with inflammation and cancer and all. How many more do we need for people to actually believe that it's connected to the body?
I think it was a Seinfeld episode that really did us under when we got they're just dentists and Kramer was like, wait, they have their own schools? I think that just threw us for a loop.
It did. That
Yeah,
probably
set
was
us back a
the
little bit.
downfall right
Right,
there.
for sure.
But until that, I think we're starting to see it more now. Oh, it is part of it. It does cause other issues. And that, to your point, I think that when it does start to finally connect a little bit more, but gosh, it's been a struggle.
I mean, there was another study that came out this week that was talking about people that had endo done, their blood sugar was better. So there's so many, like you said, it just is continuing to come out that with a healthy mouth, if you do some flossing, if you take care of your teeth, a healthy mouth leads to a better, longer overall health outcome for you.
So you've talked a lot about the great things that are coming our way. Is there anything that worries you about the technology that, because there's a lot of discussions about the potential uh, downfalls of AI. Is there anything that worries you about the technology?
Yeah, that's a great question. I'll say this. I know on the diagnosis, so there, when we talk about AI, there's probably, I don't know, it's at 30 buckets, 30 different ways that you can use it in an office. It's not just diagnostics, but let's just talk on diagnostics right now. It is difficult to talk to a doctor and say, "Hey, listen, do you miss something? Are we human, basically?"
In diagnostics.
In diagnostics. And I think most of us will go, well, yeah, I'm sure there's something there. And we did a study about 8 years ago now, and it showed we were all expecting, so we'll go down this road a little bit. We were all expecting us to have missed, let's say on an x-ray, a little bit, right? Couple percentage points.
Mhm.
Like, and when we did the study, what we found out was, no, it's like 20 or 30% of lesions are missed on x-rays. And so we said to ourselves, that can't be right. So we did it again. Same result. Then we said that can't be right. And then we allowed a lot of these vendors that are out there now to do their own studies because they all had to do them for the FDA, correct? To get them credentialed or certified. They have to give the FDA the similar studies, but on their own, third party. They were getting the same result. So now, let's step back for a second. If I'm sitting with a doctor and I go, hey, listen, it's hard for me to say to a doctor, I think we're probably missing 20 to 30% of lesions. I can't be right. I mean, because
Can't be right. That shocks me.
it shocks me and it makes me feel bad, right? Let's talk about the psychology of it, right? Wait, I'm missing things at that level? And this is not just us. Again, you look at radiology and medicine, there's similar stats on percentages. And we wear so many hats in dentistry, as you know, Bill. I mean, it's like HR, and that's what I love about how we do things at Heartland is that we have people and teams that wake up every morning and that's what they're focused on. So you don't have to worry about all these different segments. Now, we're not, we're radiologists, we're surgeons, we're diagnosticians, there's like a whole list of things that we are and we have to be. Now, can AI help us in this realm? It absolutely can. But going back to, yeah, we're missing things. So now when I talk to you, Bill, and I go, hey, all right, use it because I think we might be missing things just to give you a heads up. Is this something? And then Dr. Bloink is the one that looks at it and says, is it something or not? That's what I like. At some point in time, we're going to get a white paper or a study or dental schools are going to say, no, you got to use it. And then there's a liability thing. It's not there right now. That's the question I get right away.
Right.
I don't want to use it because am I liable when no, you have final say. So again, I'll hand it off to Seth because I'm sure he's got a couple points on this too.
Well,
It's a big topic.
it is, and there's a lot of ways this could go. And I think one of the great things that we get to do is I get to wake up every day and try to figure out how to make dentistry better for clinicians and for patients. And part of that 8+ years ago, we were in rooms because of Heartland's influence to offer opinions on this type of technology. A lot of the companies in the beginning wanted this to be a definitive diagnostic tool. Like this is the final diagnosis. And we were very adamant that this was an aid to the doctor because ultimately the doctors are the ones that make the decisions for their patients and the communities that they serve. And so we were very passionate,
Yes.
I would say, that it was important that this was an aid so that it always went back to the doctor to make the final decision. But I think the challenge to what he's saying is if we believe the best dentistry is the least dentistry, and the least dentistry being dentistry earlier on in the life cycle of damage, then we owe it to our patients to analyze any data that we can get or any information that we can get in the diagnostic appointment to say, how can we help you? How can we help you be healthy? How can we help you be healthy earlier? How can we use things like Curadont now and say we can help heal a tooth before we ever have to drill on it and start that cycle of drill, drill, bigger fill, crown, root canal, eventual extraction, implant, that whole life cycle of damage, we can help stop earlier. And if we believe that the best dentistry is the least dentistry, catching it earlier in that cycle is better. Now, the biggest, I think, challenge for us is the change management component.
That's a big one.
And that goes back to what Tim was saying. It's a belief window. If a doctor says, I don't necessarily believe I need it, even I remember the first doctor that said, okay, you can use 1 million of my patient x-rays And we went through like de-identification and all that to make sure everything was no PHI and all that was on it. And we gave him the stats of what was going on and his x-rays versus what basically an FDA approved model showed. And he didn't like it because he's like, there's no way I have missed that much stuff. Right. And so back to the change management thing, even if he didn't need it, though, is it fair to his patients not to look at it and not to say, man, I see this earlier now, or it put my eyes to something that I would have missed otherwise. And we all get tired. And like Tim said, we all miss stuff. None of us are perfect. And so I think it's super important that we owe it to our patients to look at this stuff. But people are people and people don't like change.
Yeah.
And we hear it all the time from I hear it all the time from other dental groups, from other dental offices. How do you get your supported doctors and teams to buy in, to understand? And I think we do that on the front end. As we look at technology and we look at innovation, we look at how a doctor thinks about this, how this influences the team, what's in it for them, how it hits every single person in the office in the pilot stage before we go to rollout, because we have to understand how to make this easy. Because if it doesn't fit in the systems of the flow of what they do day in and day out, it's not going to work. They're not going to adopt it. I'll give you a short story. A friend of mine worked for a diabetes innovation company. They had a great diabetes 1 treatment where it was super easy. It was really data driven. Great results. But the doctors that he tried to work with said, it won't work in our office because this is how we do it. And unless my team can do it, then we're not doing it. And he never could overcome that. And that was something that always stuck with me, because it's like, you have this thing that will help somebody, but you really have to think through change management. I think that's one of the great things that Heartland really does, is we think deeply about change management so much. Tim was talking about all these different support levers we have. I get to work on innovation and AI all the time, but we have people that work on change management from a full time and help an office to say, this is an ideal way to use this. Obviously, everybody's office is a little bit of a different ecosystem. And so I think that's what's unique about what we get to do, is there's so many similarities and systems that work, that are consistent, but every office is based on the community that they're in, and they're unique. And I think that's what really special about kind of our collaboration of people, if that makes sense.
That's terrific. You talked a little bit about um, underutilization of technology. I also see a potential danger in the overutilization of technology. I mean, there's such a dynamic between a practice, a doctor, and his or her team, and a patient,
Yes.
to where if we overutilize the technology, do you see a danger of a doctor, for example, just saying, well, this is just what the technology
Correct.
says.
Yeah. Here's what it is, and you got to put a crown on it. No, I think I want Dr. Bloink to make that decision, not the software to make the decision. Now, will that happen in the future? I don't know. I mean, I do think at some point they're going to say it's more accurate than we are. Well, then what happens? So but going back to you can over rely on it, you can under rely on it. But what we found is, and we did a big study on this, the bell curve of results of this, every single doctor that utilized it missed less and got better case acceptance. And that's the key.
I think to piggyback on that really quick too, is if you believe as a doctor that what you're diagnosing for Tim, so if Tim's your patient and you say, Tim, I believe this is what you need, and you have a tool that 20% more of the time he's going to say, yes, I'll move forward with treatment, and you believe that's the best thing for him in that moment, I think you owe it to him to say, hey, here's what this shows you too. Just because a picture's worth 1,000 words, and that say, but you always say something that dentistry is not the tooth business. It is the people business. It's about the person that's in the chair. And so over reliance on technology is a concern for me. But one thing through the lens that I look at that is that lens specifically of us being in the people business, because we can use technology for the manual things that are being done within the office flow now to be able to spend more time on that human to human connection. that doctor-patient relationship, to that hygiene-patient
I
relationship.
love that.
And so I think that's where I get super excited about things, because we can actually make dentistry even more relational. So as we think about things that take a long time in an office, notes take a long time for doctors and for hygiene to work on notes in the course of their day. And so if there's something that helps them automate that process or make that process easier, and there are technologies that we're looking at that do that, then that gives you more time with your patient. And I think those are the things that I get really excited about, is how can we save that manual time perio probing? I mean, how many of our hygienists would love some sort of voice perio probing? I believe it will be mainstream by the end of the year. A lot of the things that we're working on that influence dentistry as a whole, I think, will come to fruition and are super exciting too.
And that excites me for young doctors, because young doctors are so focused on the technical aspects of their work that sometimes they miss the relational part. And so, how do you see that the AI helping newer doctors uh, expand their horizons in all aspects of their practice? And at the end of the day, as you guys said, we are in the people business,
Yeah, we are.
and anything that we can do to help people is good.
100%. And I'm in a double-edged sword this for us. Ready?
Yeah.
It's a big term, right? Um, they did a study, I remember it was 30 years ago, Bill, with intraoral cameras and a hand mirror. And they found the results were the exact same, because it's what you talk about and how you communicate to the patient that's the most important thing. So meaning, take a couple pictures and show it to the patient, or give them a hand mirror and really talk to them about, you see this right here? It's you. Again, if we're making a message out there, it's, yeah, use the technology wisely, don't overuse it, but also understand it's a people business.
And so I think it goes back to what Tim was saying earlier, is like, what's your mindset? Are you a glass half full? What's your perspective to this situation? Or do you see your 100+ problems a day as problems or opportunities to solve?
That's great.
And I think that's
Love it.
like,
That's a win for everyone.
right, for sure.
Big time.
Got 30 seconds. I want to ask you both this question. If you could bust one myth about AI and what's coming with AI in 30 seconds or less, what's a myth that you would bust about AI?
Well, that's a tough question. I think that it's going to fix everything on its own.
Great.
And I get two. Well, let's say two. And that it will replace everybody's job.
Oh, that was the one I was going to take.
I took a second one, because I don't. The fear side of it's going to take my job is unfortunate, because I don't believe that's true. I think we also can't bury our heads in the sand and say, I'm going to live in a world without that, when the world is going to have that, if that makes sense. So you have to be conscientious of how to exist and how to live in a world that includes software and technology that does things to help us day in and day out. So I don't know. It's not going to take. We're in the people business.
Yeah, and I'll just
Sorry.
very
Steal your
no,
job.
no, no.
Hey,
Hey, you can't just throw out 6 of them and then
I
hey, try to beat that.
Yeah.
No, I do think a lot of people think it's going to take their job, and all I'll say in that is, listen, the train has left the station. Feedback is the most important thing right now. Meaning, if what's working, what's not working, what you want it to do, please voice it. And I know for a fact people will get it, incorporated in whatever they're working on. That's the key part here. Ride the bus, and give feedback. That's all I want everybody to do.
Because we're going to continue to learn and work on doctors' behalf. It's what we do every day.
Or
like,
doctors, yes.
At the end of the day,
Yeah.
it is for doctors, their teams,
Yes.
and the patients.
Yes.
Well, fellas, I want to thank you both for being with us today. It's been a real pleasure in this inaugural session of the Masters and Mentors podcast. If you are interested in learning more about our podcast, follow us at heartland.com/podcast so you never miss another episode.